Good evening, Los Angeles. Let me start tonight by sending all of our thoughts and our prayers and all of our deep feelings for everybody right now who across America is experiencing power and water outages in Texas and Oklahoma and every community that's been hard hit by these winter storms. We have family and friends, folks who have helped us in our tough moments, and right now we want you to know that we are here for you as well. I've been in touch with my fellow mayors in San Antonio and Dallas, in Houston and Austin, and we know how difficult and how hard this moment is for them. This past year reminds us how connected we are as a people and as a world, as a nation. We've seen that as a deadly virus ignores boundaries and borders across our nation, but we've also seen it the way that emissions on one continent can influence the weather on another. This crisis of COVID is matched also by the parallelism of our climate crisis, one that every single day reminds us that this crisis that has kept us apart must be solved by us coming together, and certainly that solidarity we feel across our country today. We also felt that while we didn't experience the tough winter weather, it has affected us here in Los Angeles, when today that we learned that 2 shipments of Moderna vaccines were expected to arrive in LA this week were delayed due to the severe weather that's making planes unable to fly with those badly needed doses here in Los Angeles. As a result, about 12,500 patients with appointments tomorrow for vaccinations at our large vaccination sites have had their appointments rescheduled automatically and will receive a notice of a new date, time when the shipments arrive, hopefully in the coming couple of days. But one thing we won't pause on, even in the face of terrible weather and logistical challenges like these, is our commitment to equity. And even as we have to close down for a day those large vaccination sites, our mobile equity sites, those vans and those vehicles that are going out into communities to make sure, especially in hard-hit, high-density, low-income communities of color, we will continue to vaccinate tomorrow and on Saturday. We know these vaccine shortages and the inability of planes to deliver these doses is not unique to LA. It's a nationwide problem, and it's been reported here in California that in Fresno, in Orange County, Santa Barbara, and San Diego counties have all experienced similar delays and have had to shut down their vaccination sites as well. And it's frustrating news. I know it comes on the heels of other vaccination delays we've experienced in Los Angeles this week. Over the last few days, we've been prioritizing second dose appointments at all of our vaccination sites because supply was already limited. But if you've signed up for your first dose at a city site but received notification that your appointment has been delayed, don't worry. Your appointment has already likely been rescheduled. And if you're waiting on your second dose at one of our sites, you'll still get it within that time period recommended by the CDC. And you'll receive a text and an email notification with an auto-scheduled appointment, as well as a phone call that will come from a phone bank. We are in a race against time, a race between infections and injections. And anything that slows down our progress is unacceptable. Let me be clear, this is not a reflection of how fast we can get vaccines in the arms of Angelenos. Our infrastructure here in Los Angeles, as it's been for testing and so much more, is among the most efficient in this country and in the world. It's not a reflection of how hard we're advocating. I continue to call for more vaccines every single day at the state level and at our national level. And this is not a reflection of how committed we are to distributing this vaccine safely and equitably across all of our communities with a special focus on communities that are losing the most people. Simply put, this is a reflection of the fact that Los Angeles isn't receiving enough vaccines from the federal government to meet our daily capacity. Case in point, this week, we were only allocated about 60,000 vaccine doses. That's about 60% less than what we are capable today of delivering. So as soon as we get more, we will do much more and protect so many more lives, restart our economy, reopen our schools. And I've said this to our state partners, and I'll say it to our federal leaders, give us the supply and we can vaccinate everyone by July. But even as we push for more doses, the vaccines that we do have are going straight into arms and without delay. So let me share those numbers with you. As of today, the city of Los Angeles has administered 336,088 vaccine doses at our vaccine sites, including the newly opened Pierce College site in Woodland Hills, which is operating as both a testing site and a vaccination center. We've used 96% of our city's allocated supply, something I'm very proud of. And it shows that we aren't leaving doses on shelves, we aren't wasting any doses, and we're making sure they all go to as many of you as possible. At the same time, we're seeing still disproportionately low vaccination rates among many of our Black and Latino populations and communities, a reflection not only of historic distrust and community trauma, but also the structural barriers that stand between too many Angelenos and their access to vaccines. We need to tear those barriers down. Earlier this week, I joined with Governor Newsom and representatives of the Biden administration and FEMA at Cal State LA to open up one of the two first national vaccination centers, community vaccination centers, being operated by FEMA, aided by personnel from our Department of Defense, that will bring vaccine access to one of the most diverse and economically disadvantaged communities here in Los Angeles on our east side. Together with mobile teams that mirror the ones that I just described here in Los Angeles, we are meeting that mission, a pilot program that we started here bringing mobile vaccination clinics directly to you, directly to communities in our densest, most historically disadvantaged areas, and partnering with trusted community organizations in South and East LA with council members who represent those areas. We've administered more than 4,000 shots in the first 2 weeks of this program, with 2/3 of them going to Black Angelenos and 90% of them going to Angelenos of color. Those numbers make it clear. When it comes to the hardest hit communities, we're going to hit those communities with vaccines as much as we can. There is work to do and no time to waste. So tonight, I'm announcing a new city initiative, Mobile Outreach for Vaccine Equity, or MOVE. MOVE is a program to scale up these mobile vaccinations across the most vulnerable parts of Los Angeles so that we can lead as we have throughout this pandemic, when we brought down African American deaths to under the represented population by surging testing in communities that needed it most. MOVE will put a total of 10 mobile vaccination teams in the field by the end of next month, deploying them to areas with a high risk profile, measured by the LA County COVID-19 medical vulnerability indicators. When we get the supply over the coming weeks, and we, make no mistake, will get that supply, we will be able to scale and have the capacity to vaccinate tens of thousands of people each week. But it isn't enough just to pull up to a community and wait for folks to arrive. You see, vaccines can be a powerful instrument of equity. They can help actually reach the people who are suffering the most, who are most at risk of dying. And that really is what Los Angeles has shown this year. By leading with love, by going where we are needed most, we're able to save those lives. So starting this week, MOVE teams have continued their work alongside local community organizations and leaders to help the people book appointments, secure the transportation that they need, and to build trust and confidence in our vaccines. MOVE teams have already begun to vaccinate Angelenos across the city, in South Los Angeles, on the east side, Northeast Los Angeles, and soon in the East Valley and beyond. And I want to thank my colleagues, Council President Nuri Martinez and members of the City Council, and their staffs who are working so hard to connect those Angelenos we don't see, we don't hear from, who might be shut away in their homes by themselves, and making sure they get that access that they need. And thank you to CORE and LAFD, who are the people behind these teams, making sure the brilliance that you see at the mass vaccination sites is somewhere in a neighborhood near you. We've also continued our progress in making vaccinations easily accessible for people of all abilities, something I felt very strongly about and welcomed when the state opened up vaccinations to folks who are living with disabilities. And tonight, I can announce that we will open an express lane at Dodger Stadium for customers of Access Services, which is the agency that provides transportation to Angelenos with disabilities. That new express lane will open up this coming Monday, February 22nd, and dedicate access for folks who have those challenges getting to a site and being able to drive through those centers. And beginning this Sunday night, Access riders who are eligible for the vaccine can book their vaccination appointment and a round-trip ride to Dodger Stadium. Just simply call the Access paratransit number at 626-532-1616. That's 532-1616. Bottom line, your abilities, your ethnicity, your geography, none of these should be a barrier to you getting a vaccine. We have a long way to go in our fight to protect all Angelenos from COVID-19, but speed and equity are our guideposts. I will never stop being impatient for you, and I will never stop bringing an equity lens to make sure nobody is left behind. As vaccinations speed up, serious challenges still remain in our path. The county continues to report new cases of B.1.1.7, the UK variant, and cases are still too high. We're losing too many people to this virus. We might feel good about the way the numbers are headed, but we can't feel good about the 153 people across LA County and 59 in the city of Los Angeles that were announced that we lost today. It's a staggering number. Still over 1,000 people a week, our neighbors, our parents, our grandparents, our brothers and sisters, even our children are being lost. Yet, even in the face of that bad news, there is a lot of reason to be very hopeful. The data is pointing in the right direction. New coronavirus cases here in LA County have dropped again, 34% just since last week. And hospitalizations have dropped as well, 27% over the last week. And the number of people in our intensive care units battling COVID-19 is at our lowest level since December. This is all welcome and good news. It mirrors trends taking place across California, across the United States, and it signals that the state may soon move LA County to a less restrictive tier. And elementary schools now that post their safety plans are now eligible to open to in-person instruction. That's a testament to the hard work that you've been doing, to bend this curve down, to flatten it, and I need you to keep it up. Opening our schools has to be our highest priorities. We can't have card rooms open and not classrooms. I'm prepared to help eligible teachers and school staff get vaccinated when we have the supply, an offer I've made to the district, an offer I've made to our unions, and we will be a part of making sure that those educators and critical folks working on the front lines of food and transportation, folks who've been working in our schools this entire year, and teachers we want to see return on March 1st are given that high priority. One of the tools that has been so effective here in Los Angeles in saving thousands upon thousands of lives has been testing. And I have a big announcement to make there tonight as well. Since we became the first big city in America to offer universal testing, free to everyone with or without symptoms, we've tested more times than there are people in the city of Los Angeles. Over 4 million tests across 14 city-run sites, 136 nursing facilities, and over 150 mobile sites we've set up around the city. At every stage of the pandemic, we've tried to remove barriers to testing, because when you know your status, you know how to communicate with others, to help stop the spread, to know what you need to do to isolate or to quarantine. We've placed sites in hard-hit areas, we've put mobile teams in our public housing developments, and we've created a walk-up system for folks without reliable internet or phone access. So tonight, we have another landmark in our testing program. Beginning next week, you will no longer need an appointment in order to get a COVID-19 test at a city-run site. That's right, you don't need to set up an appointment. Just show up during normal hours of operation, Monday through Saturday, 8 a.m. to 3 p.m., and you'll get your test. Moving forward, you can register your information while you're waiting in line. Just bring your insurance information or your ID if you don't have insurance. You can still register for a test ahead of time if you want that peace of mind, but it's no longer necessary, and if you need a test, you can just come by one of our centers. To find one of the more than 100 testing locations across the county, visit our testing site at coronavirus.lacity.org/testing, or just give us a call at 311. As we scan the landscape of this pandemic in the days ahead and the path ahead of us, we can take heart from what is driving improvements here today and can accelerate our progress in the weeks and months to come. Our public health experts give us 3 reasons that might explain the recent drop in cases. First is seasonality. We know that viruses often change their intensity over the seasons. And as we look at spring coming and summer coming, it may be that the worst of the winter has peaked. The second reason is that more and more people have protection against the virus. As people recover from COVID if they've been exposed or get vaccinated, there are simply fewer places for the virus to take hold. But there's one factor that still outranks those two, and that is our behavior. That third reason is the most powerful tool we still have. You're probably sick of hearing me say it, but it always bears repeating. We bend the curve when we use the tools that we know that keep us safe. You see, this has always been about all of us, the things we do, the choices we make. We're seeing good results now because of the fear we had 3 weeks ago when so many hospital beds were filling up. I don't want you to live in fear, but I want you to live with the vigilance that has gotten us through this year and protected your life and the life of people you love. As we face new variants and the ever-evolving challenges that spring from this virus, we must remember that another big coronavirus surge is not inevitable. Our individual and collective behavior will determine as powerfully as anything whether we see another explosion before the end of this pandemic or not. Our best defense against more death and devastation is us. To quote the head of President Biden's coronavirus response team, quote, "There is a path out of this pandemic, but how quickly we exit this crisis depends on all of us." So our task, my friends, is to steer our city and our nation towards that exit as quickly and as equitably as possible. We still have a long way to go, but we can keep up that momentum by doing more of the same. Following public health guidance, holding off on gatherings, remembering that air and ventilation keep the virus at bay. And we can do it by continuing to wear our masks and social distancing, washing our hands, and getting vaccinated as soon as you can. And we can do it by continuing to know our status, getting tests, isolating, quarantining when necessary. We know what works. We know how to save lives, and we know what we can and must do to defeat COVID-19. I know this is hard. It's harder than anything we have ever done collectively. But if you ever had any doubt about our capacity to strive, if you had any question about our power to persevere, if you were wondering about our ability to still accomplish the extraordinary, I hope your television was on this afternoon, when a spacecraft that was imagined and designed and built and commanded from right here in Southern California, operated out of NASA's Jet Propulsion Laboratory in Pasadena, landed on Mars. Tonight, I'm lighting up City Hall red to celebrate that feat, to show what is possible, to honor the human spirit, in a word, our perseverance. Angelinos are capable of so much, of leading this world, of being up there in the heavens and here down on earth, of saving not only our lives, but of rebuilding and reimagining a future that's better for all of us. I look forward to closing out this chapter with you, to return to the embrace of family and friends. And that day is coming soon, Los Angeles. Mark my words, you have the power to accelerate it, and we will celebrate together. So stay healthy and stay safe, and stay at home whenever you can, and sending you, as always, strength and love from here at City Hall to your home. Thank you. With that, I'm happy to answer questions. First question, please.
First question is from Claudia Pesciuta from KMX News Radio. Your line is open.
Good evening, Claudia.
Hi. As usual, I have a list of questions. Wanted to ask, given what you're saying about reopening schools and vaccinating school staff, and the fact that vaccine doses are expected to remain limited for the time being, would you give special priority to school staff at city vaccination sites? My second question, any new developments on Project Roomkey? And I haven't asked you this in a while, so I'm wondering where you stand on the issue of commandeering hotels, especially given what the city attorney had to say about this, that it can be done. I'm wondering if your wife has been vaccinated, and wanted to ask you about the no-show rate specifically at Dodger Stadium and what happens to the leftover doses there. Thank you very much.
Sure. Well, let me work backwards. There are no leftover doses when there's no shows. We kind of overbook purposely, and there's refrigerated on-site supply. So we only take out of that refrigerator or the freezers enough for what we know is in line and that we know needs vaccination. So there's virtually, no waste. There's sometimes a dose or two, literally, but I've worked the end of those days, and we even slow it down to make sure we're not even popping a box open extra or taking it out of the freezer. So there is no waste that goes on there. Second, my wife has not been vaccinated. Third, on commandeering hotels. Absolutely, I welcome that power. We need money. It's not whether we have the legal ability to. Right now, we're enrolling more and more hotels. That's not the problem. Buying a hotel, there's no FEMA funding source for that. We can pay for rooms right now. We could commandeer extra rooms. Hotels are actually at about 50% capacity right now, which is higher than, I was surprised when I heard that number today, so there's not as many hotel rooms as people would expect. But I think, as I've always said, the sky should be the limit. And I'd make that appeal again to any hotels and motels with extra rooms. Please let us know. So far, I think the number I got today was just in the last few days, we've been able to place a number, like 90 more people. The majority of those were women from Skid Row. We're about, I think, to land, hopefully, knock on wood, another 200 rooms in another hotel. And that's on top of about 2,000 rooms, which we're replenishing, and 300 rooms in those that were empty and we're filling. So right now, we've got as much supply as people from the street right now are asking for in terms of capacity, but I hope every week we continue that. And my message to the Biden administration is don't end this, and don't end this at the end of the pandemic. Help us make sure we get people into these hotel and motel rooms, into transitional and permanent housing as well. So I'm never going to put a number on the top end. If there are hotels that we can get more rooms from, we will continue to add those and be able to pay 100%. So I welcome the legal power. I've known that we've had that legal power. I can not just commandeer, I can claim any properties to do those sorts of things, but you do have to pay for it. So we have to make sure that it meets the letter of the law of a funding source. And luckily, the FEMA one allows us to do that with any hotel rooms that become available, and we're never going to stop pushing hard on those. The last one is for school staff. Absolutely. So I agree with what the superintendent said. Like give them the vaccines. We don't need to expand more and more sites right now. We need to just get people into existing sites that aren't even at capacity. So let's say we do get in a week or two, and I do expect to get much higher numbers in a week or two, especially even the backlog of these doses that are stuck right now by the cold weather. We absolutely are available. Whether that means taking Dodger Stadium, we could push through, I think, all the employees that LAUSD, for instance, has said they need to do in a couple days there, maybe opening up on Sundays or something. So we absolutely, as soon as the county allows us to, and even before the county does, we've made that offer to our unions, to the district, to do that with folks that are 65 and over who are school employees, including teachers right now. And we've been able to do that with other groups, from critical city workers to some of our longshore workers, where we have ships backed up right now. So that is something we'll continue to do. I just think schools need to be the highest priority. And even if we can cut a day off of that calendar by sharing some of our own supply when it comes, to me, that is the highest priority. Thanks, Claudia. Next question, please.
Joel Pollack from Breitbart News. Your line is open.
Hey, Joel, how you doing?
Good. How are you?
Good.
Just two questions. I guess they're both about the schools. There is a protest, according to Fox 11, planned for Monday against the schools not reopening, and I guess specifically against the teachers' union. I was wondering if you could say what it is that makes teachers different from other workers. There are essential workers, non-essential workers every day who go to work who are not vaccinated and who just take mitigation measures and precautions. Is there some reason teachers can't do that? And then the second question is about the decision by the school board this week to cut about a third of the school police force and redistribute the funds to Black student achievement. Do you think that that's going to make a difference? Will our schools be less safe as a result?
Well, I certainly hope not on the second question. I would hope that this is part of us, like I said before, what was the phrase that I used? I think it's time to ponder and not to pander, but not to just do symbolic things, but actually think through and try. Obviously, the way things have been has not always worked well, especially for communities of color, or when you look, for instance, in the African-American community and you see how many African-American males have a pipeline towards the prison system and not towards college or towards graduation. I think any investments where we can balance that better, I would welcome. And I do believe those investments make us safer. For instance, when the city of Los Angeles expanded our intervention programs, which go towards those youth who are already, because of family relationships or geography or just decisions that they had made, more likely to be or already gang affiliated, engaging with them, with non-police, helped our police and these folks with lived experience reduce crime higher than neighborhoods that just had policing or just had those programs on their own. So in other words, you don't have to choose sides on this as much as people want you to. We're going to need to have both. There are cases in which, of course, you need some policing, but we have overinvested there and way underinvested in those things that can avoid public safety incidents, avoid people from being locked away for most of their life, avoid folks from the high costs that we all pay when we don't prevent crime from happening in the first place. In terms of the first piece, look, I've had very frank conversations, and as I think everybody watching this knows how passionate I am about our teachers, how supportive I've been of our teachers' union, and also the work that I've done, whether it's settling the strike, trying to pass Measure EE or Proposition 15. I have skin in the game because I fundamentally believe in the mission of what they do and who they are. I also know that there are school employees who aren't teachers, folks who have been working all year long, preparing food in cafeterias for the food program, in the warehouses that have had outbreak, et cetera. So I think collectively there needs to be a priority on those who are already working there as school employees. And yes, for teachers who can come to a place and can provide a social good that right now is missing for our children, which is face-to-face instruction. And I always say too, I'm not promoting something that I don't see direct experience with myself. We've had city workers in our Rec and Parks Department working in confined spaces. Obviously, we ventilate them and take kids outside in essentially school-like environments this entire pandemic long through our recreation centers. And we've been able to do that safely. And I want teachers to hear that so they can be reassured. These are in the same lower-income communities of color, and we've been able to do it without outbreak. And I think the evidence shows that we should prioritize those teachers and those school workers at the very front of the line. I know the county's now said by March 1st, but we can start folks 65 and over to get them vaccinated. We know after the first shot now, evidence that came out today, you're about 2 weeks later, 92% covered, that we can safely return workers, teachers, and students to our classrooms, and that has to be the number one priority of what we do in terms of our reopenings, while we put other critical workers alongside, like you mentioned, food workers, transportation workers. I'm worried about our bus drivers and operators and rail operators, and make sure that they are at the front of the line in March as well. Any follow-up, Joel? Okay. I think I got next question, please.
And tonight's last question will be in Spanish from Dinora Perez from Telemundo 52. Please go ahead.
Buenas tardes.
Mayor, thank you for taking my question. I'd like to see if you can respond in Spanish as well. And I know you're requesting a larger supply to the federal government and also to the state. And what real possibilities do we have of actually receiving larger supplies outside of this weather situation, of course, and especially since we have the Dodger Stadium that is so large and has such a large capacity? And what numbers are we thinking? How much more could we possibly receive as far as vaccinations go? And then the other vaccines go. And then the other question is, if you can respond in Spanish to those folks who have some anxiety knowing that their appointments are being postponed and they are needing that second dose, letting them know that they will be receiving it before the deadline of it not being effective for them. I know we spoke to some elderly folks who are just desperately counting the minutes and days for them to get their vaccinations. And then once that appointment is canceled, there's a lot of anxiety there.
Yep. Absolutely. Thank you. I'll answer both in English and Spanish for both those questions, and then I'll go straight into Spanish, which I think I'll say in even greater detail some words around the second question as well. So these will be the worst weeks, last week, this week, because of the pinch and the weather, and probably a week, maybe, or two more. After that, we're going to see a rapid acceleration of vaccines, I believe, in this country. It's a simple math question. There is a guarantee to the federal government of 600 million doses of vaccine by July 1st in this country. As of yesterday, just 71 million had been distributed, which means there's 539 million doses in the next 4+ months versus just 71 in the last 2 months. I've spoken to the chairman of the board of Moderna. We've reached out and spoken directly to Pfizer. I'm confident that they will deliver earlier than they initially said by July 1st, those 600 million doses, and that's before Johnson & Johnson. So I think in a few weeks, we're going to be having a very different conversation about capacity. And those places like Los Angeles that have built capacity as we have in the city will be at the models in this country for getting more of our population vaccinated quickly. Other parts of the country, it's going to be a bear of a logistical challenge just to get those vaccines distributed. So that's what I'm preparing for, struggling through these worst weeks and getting ready for a different sort of problem. When we have so much vaccine, we have to make sure we get the throughput. But I'm confident of that. That's together with Johnson & Johnson's 100 million. That means by July 1st, really the beginning of the summer, there's going to be more vaccines than people in the United States of America. So that is, for everybody who is waiting and anxious, it most certainly is coming, as painful as these weeks are. En estos próximos meses, en estos próximos 4 meses, el gobierno federal recibirá 600 millones de dosis de la vacuna. 600 millones. Este es suficiente por 300 millones de personas en los Estados Unidos. Junto con las dosis de Johnson & Johnson, será más dosis de personas en los Estados Unidos. Por eso el problema de hoy, desafortunadamente no tenemos suficiente dosis. En 2 o 3 semanas tendremos mucho dosis en Los Ángeles, y el problema será por los Estados Unidos si usted tiene la capacidad para distribuir estas dosis. Yo tengo mucha confianza en el sistema aquí en Los Ángeles porque estamos construyendo más y más sitios, más y más personas que puedan trabajar en estos sitios, y cuando nosotros recibiremos estas dosis, distribuiremos estas dosis muy rápidamente a la población. To folks who are worried about, whether or not their appointments will be there, I think I've said in English, but I'll say it one more time. You should have already gotten your text, already received an email. And for folks who aren't as technologically savvy, seniors and others, don't worry. You're going to get an automated call letting you know that your appointment has already been rescheduled and be rescheduled for next week. So don't fear. Por la gente con las citas para mañana, no tengan miedo, porque usted tiene una nueva cita en la próxima semana cuando recibiremos más dosis durante estos días con el clima en el medio oeste de este país. Es difícil para recibir pero su cita es segura. I'll repeat some of that when it comes to, and I'm told we have one more question, so I'll take that one and then I'll go to Spanish, and I'll repeat some of that information and go a little bit more in depth in the Spanish. I'll take that last question. Thank you. Go ahead.
Sir, Patrick Healy at BC4, your line is open.
Patrick Healy, how you doing, man?
Hi. Very good, Mr. Mayor. Well, we're going to be on the air in about 10 minutes, but I had one question I wanted to ask you. Forgive me if you addressed this earlier and I missed it, but have you gotten any update on when those doses in the deep freeze in Kentucky are going to be able to reach Los Angeles, and when the major sites will be able to reopen? And actually, a second question, if I could, any concerns that maybe the city relying entirely on the Moderna vaccine limits our flexibility, that maybe it would be better if we could get some Pfizer vaccine as well? Thank you.
You bet. I think Pfizer's having many of the same problems as well as we're hearing throughout the state. It's not an issue about Moderna or Pfizer, but my understanding is that in Kentucky and Tennessee, which, as we all know, are the UPS and FedEx hubs where the planes are caught up. So I think it's not necessarily the brand. Though we do use Pfizer. Our mobile teams, as I said, will be out there, and we are using Pfizer. So we're capable of doing both. It gets a little complicated if you use Moderna and Pfizer for scheduling appointments to come back to a place like Dodger Stadium. You can't have two different kind of needles, two different kind of draws, et cetera. So it is cleaner and clear. And like I said, I think this country is going to be swimming in doses in the coming months. So Moderna is 100%, a good choice. That wasn't actually a choice we made. It's what the county gave us through the state and the federal government. But I'm confident that that will be okay. In terms of the updates and the delay, we're calling them, by the hour. And we're very anxious because while Fridays are canceled, we haven't canceled Saturdays yet, but we have to make a call on that early in the morning in terms of staffing, in terms of everything else. So hold tight to find out about Saturday early tomorrow morning when we hopefully will have some good news tonight about planes being able to come. We should get 2 rounds of 2 deliveries that have been held up, one that was supposed to get us through the end of this week and the one to start next week. So I feel like Vaccine Hunter. It should be a new reality show, but all day long we're calling the suppliers, we're calling the feds, we're calling the information services that we get from the state. And I know the state's doing the same. So I'm hopeful that some planes might be able to take off. I know they're trying to scrape the runways and everything. And I really want to give a shout out to those workers who are out there in the bitter cold trying to make sure vaccines get throughout this country, including here to Los Angeles. Thanks, Patrick.
Thank you much.
You bet.
Thank you much, Mr. Mayor.
Have a good evening. En español, ahora, muy buenas tardes, Los Ángeles. Y esta tarde, nuestros corazones están en Texas, Oklahoma y todas las comunidades que están sin luz o agua durante estas terribles tormentas. Esta crisis en una ciudad es una crisis en todas nuestras ciudades en los Estados Unidos. Y hoy sentimos esto cuando supimos que un cargamento de 26,000 dosis de la vacuna Moderna que esperábamos para esta semana se retrasó a causa de las tormentas. Como resultado, casi 12,500 pacientes recibirán un mensaje notando un retraso de su cita. Cada paciente afectada será priorizado y cuando llegan más vacunas recibirá detalles de su nueva cita, que se hará automáticamente, no solamente por email, pero por text y también por una llamada. Siempre estaremos comprometidos al acceso para todos. Y estamos desplegando clínicas móviles a las comunidades más afectadas por este virus. Y nuestras clínicas móviles no son afectadas por esta falta de vacunas, pero su cita es segura. Y tú recibirás una nueva cita este fin de semana, por la próxima semana. Esto es un problema nacional. Y los condados de Fresno, Orange, Santa Bárbara y San Diego tienen los mismos retrasos. Y si está esperando su segunda dosis, la recibirá dentro del periodo recomendado por la CDC. Esta situación hace muy claro que Los Ángeles no está recibiendo suficientes vacunas del gobierno federal para lograr nuestra máxima capacidad. Por ejemplo, esta semana recibimos nada más 60,000 dosis. Sin embargo, tenemos la capacidad de administrar el 60% más. Nuestra ciudad puede administrar más vacunas y proteger a muchas más vidas, pero necesitamos las vacunas. Necesitamos las vacunas. Si las recibimos, lograremos vacunar a todos para julio. Sin embargo, seguimos nuestros esfuerzos con lo que tenemos. A partir de hoy, la ciudad de Los Ángeles ha administrado 336,808 dosis en nuestros sitios de vacunación y hemos usado el 96% de nuestra provisión. A la misma vez, hay un número bajo de vacunaciones entre residentes afroamericanos y latinos. Tenemos que quitar estas barreras. Esta semana estuve con el gobernador Newsom y representantes de la administración Biden en Cal State LA para abrir uno de los dos primeros centros comunitarios en los Estados Unidos de vacunación operado por FEMA y el Estado de California con la asistencia de la ciudad, que brindará vacunas directamente para nuestras comunidades de bajos recursos. Y unas semanas antes lanzamos un programa piloto con la misma misión. En colaboración con grupos comunitarios en el sur y este de Los Ángeles, hemos administrado más de 4,000 vacunas en 2 semanas. Entre ellos, más del 90% se han administrado a personas de color. Es claro que este modelo funciona para proteger a nuestras comunidades más afectadas. Y por eso estoy anunciando una nueva iniciativa, Alcance Móvil para la Equidad en Vacunación, MOVE, para aumentar el número de vacunas en nuestras comunidades más vulnerables. Para el final de marzo, MOVE tendrá 10 equipos móviles en las comunidades que tienen alto riesgo de infección. Ya hemos empezado en el este, sur, noreste de Los Ángeles y en el este del Valle. Cuando recibamos las vacunas en las próximas semanas y meses, estos equipos se ampliarán y tendrán la capacidad de vacunar a miles de personas cada día. Estoy agradecido a la presidenta del Consejo y todos mis colegas en el Consejo Municipal, quienes se han unido con nosotros para lograr esta urgente misión. Además, seguimos nuestro progreso en hacer las vacunas accesibles para todos. Y esta noche estoy anunciando que abriremos un carril express en el estadio de los Dodgers para clientes de Access Service, la agencia que ofrece transporte para personas con discapacidades. Este carril abre el lunes 22 de febrero. Empezando el domingo por la noche, los clientes de Access pueden llamar al 626-532-1616. 626-532-1616 para hacer su cita de vacunación y coordinar su viaje de ida y vuelta. Mientras avanzamos con las vacunaciones, seguimos luchando contra el COVID-19. El condado está reportando nuevos casos de nueva variante del Reino Unido y seguimos con demasiados casos y muertes. Hoy perdimos trágicamente a 153 personas en el condado de Los Ángeles y 59 en la ciudad de Los Ángeles. Sin embargo, seguimos con esperanza. Los datos van en la dirección correcta. Finalmente, los casos de coronavirus han bajado en el condado de Los Ángeles, el 34% en la última semana. Las hospitalizaciones han bajado también, 27% en la última semana. El número de personas en unidades de cuidados intensivos es el más bajo desde diciembre. Y las escuelas primarias que publican sus planes de seguridad ahora son elegibles para abrir para clases en persona. Y estoy preparando para ayudar a vacunar a los maestros y personal de las escuelas cuando tenemos las dosis. Ya lo he ofrecido al distrito escolar. Esto significa que pronto el Estado puede mover al condado de Los Ángeles a un nivel menos restrictivo. Y se puede lograr si todos siguen monitoreando su estatus de COVID con hacerse la prueba y con separarse de otros en cuarentena si se expone al virus o se le sale un resultado positivo. Las pruebas son muy importantes para frenar la propagación del virus. Fuimos la primera gran ciudad en los Estados Unidos para ofrecer pruebas a personas con o sin síntomas. Y desde entonces, 4 millones de personas se han hecho la prueba en los 14 sitios administrados por la ciudad, 136 centros de enfermería y más de 150 sitios móviles en la ciudad. Y esta noche estoy anunciando que empezando esta semana no necesita una cita para hacerse una prueba en un sitio administrado por la ciudad. Solo tiene que llegar durante las horas de operación, de lunes a sábado, entre 8 de la mañana hasta las 3 de la tarde, y le darán la prueba. A partir de ahora, se puede registrar mientras espera en la línea. Solo tiene que traer la información de su seguro y su documento de identidad si no tiene seguro. Si prefiere, puede registrarse antes de llegar, pero no es necesario. Para encontrar un sitio de prueba, visite coronavirus.lacity.org/testing o llame a 311. Los expertos han identificado 3 razones para explicar el bajo en el número de casos. Primero, con el cambio de temporada a un clima más caliente, los virus respiratorios se vuelven menos agresivos. Segundo, más personas tienen algún tipo de protección contra el virus, incluyendo la vacuna. Pero lo más importante es nuestro comportamiento. El número de nuevas hospitalizaciones llegó a más alto en el medio de enero, indicando que el distanciamiento social durante el mes más frío nos ayudó a doblar la curva. Al final mejoramos nuestra situación con nuestras decisiones de hacer lo correcto. Nuestro comportamiento sigue siendo la mejor defensa contra más muertes y más sufrimiento. Todavía tenemos un largo camino adelante. Hay que seguir usando una mascarilla y practicando el distanciamiento social. Y por favor, vacúnese cuando sea elegible. Sabemos cómo salvar vidas. Sabemos lo que podemos y debemos hacer para acabar con el COVID-19. Somos capaces de tanto. Y nuestro deber es seguir haciendo lo correcto hasta que podamos cerrar este capítulo y regresar a abrazar nuestros amigos y familia. Ese día llegará pronto a Los Ángeles. Hasta entonces, quédense seguros, quédense en buena salud y quédense en casa. Fuerza y amor de la alcaldía a su hogar. Gracias.